Imagine this situation. Suddenly 50 to 100 injured patients arrive at a hospital at the same time. This could happen due to a train accident, a major fire, an earthquake, an epidemic outbreak. If the hospital does not have a disaster preparedness plan, patient care can completely collapse. That is why NABH introduced the COP-4 standard, which ensures that hospitals are prepared to manage community emergencies, epidemics, and disasters. What you will learn in this video. In this video we will clearly understand what NABH COP-4 standard says, what assessors check during disaster preparedness assessment, common mistakes hospitals make, and how hospitals can become COP-4 compliant. Let's begin. What is NABH COP-4 standard? The COP-4 standard states, the organization plans and implements mechanisms for the care of patients during community emergencies, epidemics and other disasters. In simple words, hospitals must develop a structured disaster management plan to manage patient care during emergency situations. Objective elements of COP-4. The COP-4 standard includes several important elements. Identification of potential disasters, documented disaster management plan, availability of medical supplies and resources, disaster plan testing through drills. During NABH assessment, assessors verify these through disaster management documents, mock drill reports, staff awareness and interviews. Identification of potential disasters. Hospitals must first identify what types of disasters may occur in their area. Examples include earthquakes, floods, train accidents, industrial accidents, epidemic outbreaks. Location-based risk identification. Disaster risks depend on the geographical location of the hospital. For example, hospitals in industrial areas may face chemical accidents, hospitals in flood-prone areas may face flood disasters, hospitals in urban cities may receive large numbers of road traffic accident cases. This helps hospitals prepare specific disaster response plans. Disaster management plan. According to COP-4, hospitals must have a documented disaster management plan. This plan should define emergency response system, roles and responsibilities, resource management. This ensures that during disasters, the hospital can respond quickly and effectively. Alert code system. Disaster plans should include an alert code system. These codes help staff understand quickly that the hospital has activated disaster mode. This enables rapid mobilization of hospital resources. Communication system. Effective communication is essential during disaster situations. The disaster plan should include communication with internal hospital departments, external emergency services, ambulance services. This ensures coordinated emergency response. Command nucleus. The disaster plan must define a command center or command nucleus. This team is responsible for decision-making, resource allocation, coordination between departments. This helps manage disaster situations in an organized way. Action cards for staff. Hospitals should develop action cards for staff members. These cards clearly define staff roles during disasters, departments they must support, emergency responsibilities. This prevents confusion during emergency situations. Resource planning. Hospitals must ensure that adequate resources are available during disasters. These include medical supplies, emergency drugs, medical equipment. The level of resources should depend on the expected disaster risk. Triage during disaster. During mass casualty events, hospitals must implement a triage system. Triage during disasters usually follows NDMA, National Disaster Management Authority, guidelines. This helps prioritize patients according to severity of injuries. Reception and treatment areas. The disaster plan must clearly define areas such as casualty reception area, triage area, treatment area. This ensures that patient flow remains organized during large-scale emergencies. Patient transportation. Hospitals must also plan patient transportation during disasters. This includes ambulance services, internal patient shifting processes. This ensures that patients are transported quickly and safely. Visitor and crowd control. During disasters, crowd control becomes extremely important. Hospitals should define visitor management policies, movement control of vehicles and people. This helps maintain order inside the hospital. Managing existing patients. If a hospital becomes overloaded during a disaster, it may need to take steps such as early discharge of stable patients, relocation of admitted patients. This helps free resources for critical emergency patients. Legal compliance. Disaster management plans must comply with local laws, national disaster management policies. A key reference document is NDMA Guidelines, National Disaster Management Authority. Availability of medical supplies. Hospitals must ensure adequate availability of medicines, consumables, equipment. These resources should be planned according to expected patient load during disasters. Disaster plan testing. COP-4 requires disaster plans to be regularly tested. Hospitals should test their disaster plans at least twice a year. Testing methods include tabletop exercises, disaster mock drills. Mock drill requirement. At least one full disaster mock drill should be conducted every year. During mock drills, simulated patients may be used. Real staff response is evaluated. This helps assess hospital preparedness. Mock drill evaluation. After every mock drill, hospitals must conduct variation analysis, debriefing sessions, corrective actions. Based on findings, hospitals must implement corrective actions, preventive actions. This helps improve future disaster response. Common NABH non-conformities in COP-4. During NABH assessments, common non-conformities include disaster management plan not documented, mock drills not conducted, staff unaware of disaster roles, inadequate resource planning, mock drill analysis not documented. Hospitals should address these issues to avoid assessment observations. How hospitals can become COP-4 compliant. Hospitals can comply with COP-4 by conducting disaster risk assessment, developing a disaster management plan, training hospital staff, conducting regular mock drills, implementing CAPA based on drill findings. These steps help hospitals effectively comply with NABH COP-4 standards. In the next video of this NABH training series, we will discuss COP-5, cardiopulmonary resuscitation, CPR, services are provided uniformly across the organization. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is Medi Quality Partners, your trusted NABH guide. Thank you for watching.